you see men and women, when they get older, they have less interest in sex or decreased libido. It's because they have these other medical conditions that you normally don't have when you're younger. So my message is that you can continue to have sexual vitality to the day you die.
Take control of your life. Break the chains and rise. No more feeling powerless. No more shame. Take your power. Break out of the pain. Because it's more than fornication, more than procreation. It's not just self-stimulation. Sex energy is for creation and transformation into a new destination.
This is Porn Talk.
Porn Talk. Yeah. Change your heart from dark to light. Porn Talk. Yeah. Break free. Take back your power and rise. I said take back your power. I said take back your power. Take back your power and rise.
This is Porn Talk. Here is your host, Eric Zuzak.
All right, here we go. Welcome to Porn Talk. This is Powerful Eric. This show is not just about breaking addictions. It's about breaking belief systems. We are bound by self-imposed and societal chains. Break those rusty, nasty old chains. Get empowered right now. We have with us today a much needed guest. We have Dr. Ann Truong. She is a board certified physician with over 20 years of clinical experience, a physician, an entrepreneur, an innovator who thinks outside the box. We love that here on Porn Talk, thinking outside the box. Dr. Ann is a recognized leader in men's health, particularly in regenerative medicine. She is passionate about healing the cause of male sexual dysfunction, not just masking the symptoms. And she shares her wisdom to teach doctors. She shares her wisdom to teach doctors conferences worldwide. She evaluates and supports each patient from beginning to end to accomplish their individual goals, recapture their vitality, age gracefully, and live their best life. Welcome, Dr. Ann Truong.
Thank you. I'm glad to be here. Powerful Eric.
I'm like I was saying before we started recording, I really am excited to have you here because male sexual dysfunction is a huge topic. I get a lot of questions about it. I've got a lot of clients with porn-induced erectile dysfunction or PIDE, and to have a medical doctor here to enlighten us all is really, frankly, really needed. So again, thanks for being here.
Well, I'm glad to be here. It's part of my mission is to educate men that they do have power and control over their sexual vitality for life. The myth that we think is, oh, when you get older, sex, you can't have the same sex that you were when you were in your 20s. That's actually a myth. It is a myth because as you get older, you should have actually better sex or even the same peak sex that you had in your 20s, because as you get older, you're more susceptible to having other chronic diseases like high blood pressure, you gain weight, or you have high cholesterol, you may have diabetes. All of that contribute to sexual performance, meaning making it worse. So that's why you see that you see men and women, when they get older, they have less interest in sex or decreased libido. It's because they have these other medical conditions that you normally don't have when you're younger. So my message and what I'm passionate about is that you can continue to have sexual vitality to the day you die. And I see that in my patient. It's just that we just don't know that. We don't know what we don't know. But once we know that, like you told me before we started, that you were powerless before, and now you just made a mind shift and thinking you're powerful. So my goal is to change that mind shift in men and saying you are powerful and are in control of your sexual performance and maintain it for the rest of your life and can have the sexual vitality. It seems like a fountain of youth, but it's not. It's definitely achievable.
Great. Typically, for me at least, prior to all this, when I thought of male sexual dysfunction, was thinking like, of an older man, somebody much, much older. But the crazy thing is I have like very young people reaching out to me that have porn-induced erectile dysfunction or PIDE. Literally just maybe 2 weeks ago, I had a 21-year-old reach out to me who has PIDE. And it just blows my mind. And it's just really sad.
Right. And that is what I'm observing as well. But before we go into that, I want to give you a definition of what ED is, or erectile dysfunction.
Please.
It encompasses from the World Health Organization as it is defined as an inability for a man to have satisfying sexual experience. So what that means is that it encompasses more than just whether you can have an erection or not. You can still have an erection, but still have ED. And the spectrum of ED span from a man not able to, it takes longer to get firm, but he gets firm enough for adequate performance, or that he's not as firm as he used to be, but still can perform, or that when he gets firm, he loses it in the middle of intercourse, or that, and then it almost even comes encompassing whether he is able to have orgasm or ejaculation, all the way to the spectrum that you had stressed before, where no erection. So what that means is that you can be 20 and all the way up to 80 and have ED because of that definition that encompasses satisfying performance. Okay, mm-hmm. So that's I want to dispel that myth right away. Myth number one is that ED only occurs in older men, and in fact, for men between the age of 20 to 40, it was a study that was done that showed approximately 21% of men in the age of 20 to 40 have ED. Mm. And that's just what's reported. That imagine if it would. I think the number is probably bigger. Yeah. In the one that that doesn't know yet, because we know that there are at least 30 million men now living with ED, and that between the age of 40 to 70 years old, there are 50% of men actually have ED. Wow. 50. Between the age of 40 to 70, wow. 50% of men have ED. I want to stress that, okay? And that the age of 20 to 40, yes, 20 to 40 is 20 to 25%. 1 out of 4 guys between the age of 20 to 40 have ED, and 5 out of 10 guys between the age of 40 to 70 have ED. So it is a big problem. And the last study that was done was actually a study that was done in 1999 that estimate that 30 million men in the U.S. have ED, and that every year, about 700,000 new ED cases occur. So it's a big problem. But another sad fact is that only 67% of the men that actually have ED know that they have ED, because they think that ED is only defined as inability to have an erection. Mm. You see? So it's a definition problem. It's an is an awareness problem. And unfortunately, it's a problem that is not discussed, right?
Yeah.
You don't, and if you're not aware of it, you don't discuss about it, you're not going to know about it. So I love to say you don't know what you don't know.
Yeah.
And I'm hoping from this show that more of your listener will start knowing something that they don't know, and perhaps that will change their life.
Yes, absolutely. And so I found this online that there was a stat that said the largest growing demographic that takes the little blue pill are 20-year-olds now because of porn.
Yes. Yeah. Well, we know, and I hope that your listener know that porn is not a depiction of what reality is. Women and for men, it's not what real a sexual experience and intercourse is. It's like a movie, right? You see these heroes, and it's not what actual real reality. Those women are not. You don't see those women walking on the street either, and they're in porn for a reason, because because of the way they can perform and make it almost like a fantasy.
Yeah.
So the younger men take Viagra because Viagra, I call Viagra hijacking your natural erection response in your body.
Mm-hmm.
And I'll explain to you why. All right, because Viagra, what it does is that it help your muscle in your penis produce more nitric oxide, which relaxes the penis muscle, which allow it to expand more, to get more blood into there, so that way your erection is more firm.
Mm-hmm.
So in order to get an erection, the penis muscle have to be relaxed.
Mm-hmm.
All right, so it has to be relaxed in order for it to get an erection. The penis muscle not relaxed, you can't get an erection. So Viagra help the muscle relax. However, it doesn't do anything to increase the blood flow that needs to flow from your heart to your penis. So a natural response for a man to get an erection, it starts, where? In the brain. The brain is the largest sexual organ.
Mm.
And I can prove that to you, because men that have been paralyzed from the neck down, they cannot move anything, not even their fingers or anything, can get an erection because their erection comes from their brain.
Really?
So the brain is the largest sexual organ. Yes, absolutely. So the brain is not your penis, it's your brain. So how a man get an erection, it starts from the senses, meaning your visual stimulation, the smells from your nose, and taste from your mouth, the sound that you hear, and your touch. Those senses input into your brain, and then that get filtered to the part of your brain that is right between your eyes and your ears, that called the midbrain, and that interact with your emotional state that you're in. Meaning, you relax, or you tense, or you anxious, or you depressed. That plays together and filter through your emotional state, and then from the brain it goes to your emotion, and from your emotion it goes to your nerve. The nerve in the back of your head, the spinal cord, which the nerve send messages to the heart, say, hey, stop pumping more, stop pumping faster. All right. And then the heart start pumping faster. That's why you feel that rapid heart rate. And then your blood vessels have to relax in order for it to get more blood flow down to the penis. And then the penis muscle have to be relaxed. So there are 6 systems that need to occur in synchrony and in sequence in order for a man to get an erection. It starts with the brain, the emotion, the nerve, all right, and then the hormones. The hormones have to be released also in the brain in order for the blood vessel to be relaxed, as well as the muscle to be relaxed. So to start again, the brain, the emotion, the hormone, the nerve, the blood vessels, and then finally the penis muscle. All six systems have to sequentially happen and in synchrony and in harmony. So that's why. So when you're taking Viagra only work on the penis muscle. So you're skipping step 1 to 5. You're skipping the brain, the emotion, the hormone, the nerve, and the blood vessel. So when you take Viagra, you're hijacking your natural response to get an erection. So so when you were saying, well, the young guy take Viagra and they watch porn and they want to be, big and firm like the guy they see in there, but Viagra, what it does is that it helps you get firm, but also will when you have after ejaculation, it doesn't get flat, it gets like half flaccid, and you remain like half somewhat firm. But there it's a black hole with that because you're hijacking your natural response. So then your body will go, oh, you know what? This is what's been happening. I'm just gonna shut down my brain all the way to my blood vessel because you already have something that's already working. So what you end up doing is that you're cheating yourself on a natural response to have an erection. It's like going to the gym and try to do shoulder press and have a robot to do shoulder press for you, and you're not doing it yourself.
That's a great analogy. That's a great analogy.
Yeah, you're really not working your muscle the way you should be, but a robot is doing that, and you're not getting the benefit of that. So when that happens, you're taking the natural senses, the input from the visual, the taste, the smell, the hand, the touch, away from the erection response. So that's why porn takes that away, because porn just gives you that visual, right? It's not giving you the touch, the smell, or the sound. That's why intimacy and emotional connection is what brings all those sensory input into your brain and what activates the whole process. So that goes back to the analogy of, I talk about a man who is paralyzed from the neck down can get an erection. You can get an erection just from your brain, your emotion, and the hormone that gets released. That's all happened inside your brain. Half of what you need to do is inside your brain to start that. And for you, when you were saying that, you used to be addicted to porn, and how, you turn your mindset from being powerless to powerful, where did that occur? It's in your brain, right?
Yes.
If that occur in your brain, and getting out of the crutch of depending upon porn to help you perform or get stimulated. Because if you watch porn and you perform better, if you relate it tied to as a crutch,
Mm-hmm.
Or you take Viagra and you go, oh God, I'm performing, I can get a better erection. But then you keep dependent upon it, becomes your crutch,
right?
And you just don't have any power. So you become powerless over your own sexual response.
So let me just reiterate what you said there. Viagra will actually end up ultimately making you even less powerful, make you powerless.
Yes.
And also, I have heard that Viagra, is this true that sometimes it can even be like cause a painful erection? Is there?
Right. Because Viagra in some men can cause what's called a priapism, which is an erection that lasts more than 4 hours. Because what it does is that it traps the blood in the muscle of the penis, and the blood doesn't go out of the penis; it stays in there. So when an erection lasts more than 4 hours, it's a priapus, and it actually, when that happens, the muscle of the penis start dying away. So that's one of the side effects of taking Viagra, is that you can literally cause a priapism, which then cause your muscle to start dying, which then lead to permanent damage in getting an erection. So there is that side effect, but a lot of lot of the side effects from Viagra is also like flushing, a runny nose, a headache, flushing, the face turn red, a stuffy nose, a headache. Those are the common thing. But another thing too, men need to know that it raises your blood pressure. So if you already have high blood pressure and you're taking a medicine, it also raises it as well. And who's going to take a blood pressure, during sex, right? So you don't know whether your blood pressure is high or not, and it can lead to, when you have high blood pressure, it can lead to a heart attack, can lead to a stroke. That's what I want to say is that your blood pressure can rise silently without you knowing about it.
Wow.
And that men that has like chest pain or heart disease cannot take Viagra with it because they're on medication for their heart, like nitroglycerin, which if they take Viagra with it will drop their blood pressure very low. That will cause, blackout and, a stroke. So there are, a lot of medical condition that you should not take Viagra with. And I want to mention also that Viagra does not work in about 30 to 40% of men that take it. Right. So just know that. So you take it, it doesn't work. It may not work for you. And, about a third do not respond to it at all.
Wow, man, this is really enlightening. And in addition to the porn epidemic that's going on, there's been a obesity epidemic, and with that, if these guys are suffering from ED and are wanting to pop the little blue pill, then if they don't already have blood pressure problems, but from being overweight, then most certainly the blue pill is probably not going to help.
That's right. Absolutely. So the point is, if you have ED, don't go for that little blue pill because we all want that pill. A pill is a little quick fix, right?
Yeah.
And the analogy of Viagra, it's almost like taking opioids, pain medication for pain, right? It treats the symptom. It not even treat. It reduces the symptom, but in the long run, you end up in a black hole, and you're causing your condition to worsen over time because you're neglecting the real cause of the problem. So fortunately, 90% of ED is physical, and 10% is more psychological. So the point I'm trying to make with the Viagra as a medication, that the side effects that we mentioned, but it's also making you powerless as well. But another point is that it becomes a crutch. So it becomes more mental.
Yeah.
You're relying on it to perform. And when I treat my patient, they're like, oh, I can't throw away my Viagra. I need it to perform. I go, you can perform, just throw it away. Like, for instance, tell you a story, a patient of mine, Alec, and he'd been taking Viagra for 3 years and noticed I had Viagra not working as well as it used to be. I saw him and I treated him with a stem cell hormone replacement therapy, and our treatment was using the multimodality approach of, and I was able to restore his erection within really about, a month again. But he was still taking Viagra, even though he wakes up with a morning erection, even though he, and he had a firm erection with that. But when he has intercourse with his girlfriend, he was still taking Viagra because he had them. But in his mind, he's thinking, I need Viagra every time I have sex with my girlfriend. He couldn't get over that, even though he can get an erection naturally.
Yeah.
It became a crutch for him. So we have to work with him and say, you got to start throwing it away. But it was almost like an addiction. It's an addiction to get away from that crutch and to get away from that process that, hey, if I'm going to have sex, I don't need the Viagra. He did it one day, and he had, terrific, sex with his wife and with his girlfriend without Viagra. And that turned him into a believer that, hey, I don't need it. But it's so hard for him to drop that and not take. And I said, just throw it away so you don't have access to it at all. It's almost on the same level as drug addiction, alcohol addiction, or even weight loss, right? And trying to lose weight and trying to get away from the food that that carb.
Right. I love what you're saying because there's so many myths about porn-induced erectile dysfunction or just erectile dysfunction in general. And, if you turn on the television or listen to a podcast or whatever, there's these commercials for all these ED commercials, for pop this pill and pop that pill. And so I'm so glad you're here to dispel some of these myths. Is there any other myths around male ED?
Right. So we talked about. So I have an ebook which your listener can get for free if they go on my website at truongrehab.com, TRUONGREHAB.com, and we cover myth number 1, which is what is ED. Myth number 2 is that Viagra is hijacking your erection, and myth number 3 is that ED doesn't go away. Once you have ED, it does not go away. It's a pest. It's like an infection. You got to treat it, because if you don't treat it, it's gonna fester. It's gonna get worse. So it's not gonna go away on its own, and you have to do something about it. And that doesn't involve taking that Viagra medicine or taking that mythical supplement that you see online. Because
Yes.
what I see with my patient is that, if they have ED, they're not going to talk to their girlfriend or their wife. They're probably not going to talk to their friend. They're going to go on Google,
Right.
because it's such a private matter.
Sure.
They're going to go on Google, and guess what? They become a victim of Google, right? They thought, oh, this supplement called Mayada or men's performance or whatever. I'm going to take this supplement. It's going to it's going to help me with my ED. Or I take this medication, or they go in an online dispensary and order an ED medication. And that goes back to what we discussed about why they shouldn't take the medication. But they go to Dr. Google and they become a victim of the sale tactic and so forth. And so what I'm trying to say is that they need to realize that they need to treat the root cause of the problem and go to the right place to find out, okay, what do I need to do? It's like if you're taking an ED medication, it's almost like having chest pain, and then you're trying to take a Tylenol or an Advil for your chest pain. Because you have chest pain, you're gonna go to ER, right? You're gonna go to ER, you're gonna go see the doctor, because that's gonna lead to worse things. Well, ED, I'll tell you a fact about ED. ED is a check engine light for a man's health. So if you have ED, you better be worried, because it's a check engine for you to say, what's going on with me that is causing decreased blood flow to my penis? That's what ED is, a decreased blood flow. What's going on that's causing this? So the first thing you need to do is look at the root cause. And I'll go over that, when we talk about the treatment. So that myth number 3 is that ED doesn't go away. And that you need to do something about it by finding out the root cause of what it is. So the myth number 4 is that using an online dispensary to order the ED medication. We get back to why medication does not work, but the online dispensary, did no one evaluate you? Somebody's got to listen to your heart. Somebody's got to listen to your lung. Somebody's got to feel your pulse. Somebody's got to see what you're like. An online dispensary person is not going to do that. From what I hear from my patient, they take you. Yeah.
Black market for it too.
Right. It's a black market of ED medication or supplement that doesn't work. So you really, but what they do is they're predators for the men that are going on Google, because only about 12% of women actually talk to their doctor about their sexual dysfunction. And there are a validated questionnaire for ED, which is called the IIEF, International Index of Erectile Function, as well as a test that can depict whether you have low testosterone hormone. So that that is myth number 4, is that the online dispensary. And myth number 5 is that the simple things that you can do. Look at your lifestyle. What are you doing that is possibly contributing to why you have ED? Simple things such as smoking, excessive alcohol. I mean, a man can take 14 drinks a week and it's okay, but when he goes over to like 20, 30 drinks a week, that can cause blood flow problem, which then can then lead to ED. So I mentioned smoking, diet. Diet high in carbohydrate, high in simple carb, actually will harm your erection. I'll tell you why, because the penis is the single organ in the body that has the most blood vessels of any organ in your body, more than your kidney, more than your liver, because when you have an erection, per gram, it has more blood vessels than any organ. So having said that, because it has so many blood vessels, it's very sensitive to what's flowing in your blood, right? So what flows in your blood? What you eat. What you eat is what nutrients you're giving to your organ, your body, your cells, to what it can absorb in. So if you're eating in a donut in the morning, followed by bread with butter and a hamburger, and then followed with cheese and so forth, what do you think is floating in your blood vessel? It's that sugar, that fat
This
that's
visual
floating
is
in your blood vessel, right?
that visual is powerful.
It's very powerful.
The
I know, but
hamburgers,
that's
the hamburger is and fries are floating through my penis now.
exactly. Oh, I love that. I love it when you say that. Hamburgers and fries, so it's fat and carb, is floating to your penis. So what's going to happen is that it's going to decrease the blood flow to your penis, because it's going to block the blood vessels that is the piping, that how you get blood into your penis. But your penis is very sensitive to what you eat because it has so much blood vessels. And I see my patients literally just change their diet from the diet of high fat, high carb, to a Mediterranean diet. Yeah, it literally will improve their erection. So we talk about the diet, talk about smoking, talk about alcohol, and another thing, sleep. 7 hours of sleep a night can help your erection. Yeah, because oftentimes we neglect sleep as the first thing that, when we're stressed or when you're too busy working. But when you sleep, your body heals itself. And I want to stress it. Your body heals from 10 p.m. to 6 a.m. So from 10 p.m. to 2 a.m., your body heals emotionally and psychologically. From 2 a.m. to 6 a.m., your body heals physically. And I mean like repair. I mean, that's when your body starts ramping up its hormone. That's when your body starts to repair itself. But if you don't allow your body to repair itself emotionally and physically between 10 p.m. and 6 a.m., and you go to bed at 1 a.m., wake up at 6, you're not allowing the time for your body to recuperate. So that's going to affect your erection, because you're not allowing the time for healing. So just simple things like that. Evaluate it. Okay, I have ED. What am I doing? Am I exercising? What diet am I doing? Should I be? You need to be exercising 3 times a week, 1 hour at a time. Just simple things like that I had mentioned will go a long way, instead of just getting that little blue pill and it's and then keep taking it and just neglecting lifestyle factors that contribute to that. But also I want to stress that the number one contributor of ED is really medication. Like what medication you're taking, like high blood pressure medication can affect ED, antidepressant like depression medicine, anxiety medicine, even and another thing too, like pain medicine, like opioids, like hydrocodone, morphine, oxycontin, and smoking, nicotine, as well as recreational drug. Those can contribute to ED as well. So the number one thing is look at what you're doing, your lifestyle, what medication are you taking. I also want to mention the typical antihistamine, like Benadryl, like even Zantac, medicine for ulcers, like Pepcid and Zantac. Those can actually contribute to ED as well. So on that topic, what's the number one contributor to to a man having ED? So number one is actually alcohol.
Wow.
Alcohol, yes, alcohol,
Do-
followed by smoking, followed by medication.
Dr. Ann Truong, a mammoth wealth of knowledge. We have to end here today, but she's going to be back in the next episode. We're talking more about the problem here with ED. In the next session, we are going to go further into some solutions. So check back with us in the next episode with Dr. Ann Truong. And I'll close today with a quote from my favorite speaker, Zig Ziglar, who says, "You are what you are and where you are from what has gone into your mind. But you can change what you are and you can change where you are by changing what goes into your magnificent mind."
Join Powerful Eric's free Facebook group, Endeavor to Quit, and take control of your life. Learn more at powerfuleric.com.